My name is Philippe Deslandes. I have been active my whole life. I started competing very seriously in volleyball from the age of 13. At around the age of 26, I suffered from an injury called osteochondritis dissecans. The orthopedic surgeon that saw me for that particular injury told me that that was the biggest lesion that she had seen at that point in her career. It required extensive rehab post-surgery at my end. I had moved to the Cayman Islands at about the age of 29 with all of the rehab that I had done. By the age of 31, I was competing in beach volleyball. But the problem was, I started to feel pain. By the time I was 36, the pain was so much that I was forced to figure out which direction I was going to head in. Was I going to continue competing or not? This is where Regenexx came into my life.
Philippe came to us 2014. He had bilateral knee pain, so pain in both knees. I believe the right knee was worse. This knee had already had a prior surgery. So we decided, hey, he'd be a good candidate for treatment. And for him, we did a same-day bone marrow concentrate procedure. Athletes and people are looking for the long term. They're not looking for the quick fix all the time, just pain management. They're saying, hey, how can I preserve this knee? People are living longer, people are getting healthier, people are more concerned about health span and longevity. So you don't want to be 60, 70, 80, every joint's replaced, you can't do the things you want to do, you want to stay active. And so here at Regenexx, we provide that ability to fix these injuries, heal these injuries so that you can preserve your joints and live a long, active, healthy life.
It's now been 11 years since I had that procedure. And I've been pain-free, basically, ever since that procedure. Still to this day, I feel, as a 48-year-old probably should. I try to keep as fit as possible. I can squat pain-free these days. I don't push the levels that I used to, but functionally, I'm perfect. I'm still doing a bunch of surfing. I still get out in the court and beat up on the youngsters and beach volleyball every once in a while just to feed the ego, I suppose. But overall, I feel as good as I possibly can relative to what I've been through. Whenever I feel like it's clinically appropriate, I try and point people in the direction of stem cells and Regenexx because of my personal experience. If someone's ever at a crossroads and they're not sure where to go with treatment anymore, if they want to possibly avoid surgery because it's so invasive, I would highly, highly recommend stem cells and of course Regenexx. And I have all these years. Mm-hmm.